Veilleux The Fam here. Welcome to the final installment in our mini mental health series on borderline personality disorder. And in this installment, we will be covering the diagnosis and treatment of borderline personality disorder. But before we begin, let me remind you to watch the full video because in the video there'll be 3 key words. Now, when I get to the keywords, I will say keyword and then what the keyword is. So make sure you watch the full video to get them keywords. At the end of the video, in the comment section, along with the genuine comment on the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. How do you diagnose borderline personality disorder? Well, diagnosis for borderline personality disorder is fairly simple. It's basically diagnosed by a detailed interview with the doctor or your mental health care provider, a psychological evaluation that may include completing questionnaires, of course, your medical history and exam, and a discussion of your signs and symptoms. A diagnosis of borderline personality disorder is usually made in adults, not in children or teenagers. And the reason is because what appears to be signs and symptoms of borderline personality disorder may disappear as children get older and become more mature. So how do you treat borderline personality disorder? Well, the treatment is fairly simple. Borderline personality disorder is mainly treated using keyword psychotherapy, but medication may be added. Your doctor also may recommend hospitalization if your safety is at risk. Treatment can help you learn skills to manage and cope your condition. It's also necessary to get treated for any other mental health disorders that often occur along with borderline personality disorder, such as depression or substance misuse. With treatment, you can feel better about yourself and live a more stable, rewarding life. Now let's discuss what psychotherapy actually is so you'll know what it is, because it does sound complicated, but it's actually not. Psychotherapy is also called talk therapy. So it's pretty much talking, like in a group or by yourself. And what this talk therapy or psychotherapy is, it's a fundamental treatment approach for borderline personality disorder. Your therapist may adapt the type of therapy to best meet your needs. The goals of psychotherapy are also there to help you focus on your current ability to function, learn to manage emotions that feel uncomfortable, reduce your keyword impulsiveness by helping you observe feelings rather than acting on them, work on improving relationships by being aware of your feelings and those of others, and learn about borderline personality disorder. So they teach you in talk therapy or psychotherapy what I'm going over with you now. But they go in more depth with it. Now, there are different types of psychotherapy. The types of psychotherapy that have been found to be effective is dialectical behavior therapy, otherwise known as DBT. DBT includes group and individual therapy designed specifically to treat borderline personality disorder. DBT uses skill-based approach to teach you how to manage your emotions, tolerate distress, and improve relationships. Another form of psychotherapy that's been effective is Schemafocused therapy. Now, schema-focused therapy can be done individually or in a group. It can help you identify unmet needs that have led to negative life patterns, which at some time they have may been helpful for survival, but as an adult are harmful in many ways of your life. Therapy focuses on helping you get your needs met in a healthy manner to promote positive life patterns. Another one is mentalization based therapy, or MBT. MBT is a type of talk therapy that helps you identify your own thoughts and feelings at any given moment and create an alternative perspective on the situation. MBT emphasizes thinking before reacting. Systems training for emotional predictability and problem solving, better known as Steph, is also another treatment that they use for to treat borderline personality disorder. Okay, it's a 20-week treatment that involves working in groups that incorporate your family members, caregivers, friends, or significant others into the treatment. Steps is used in addition to other types of psychotherapy, which I think is awesome because family and friends should be involved in all aspects so it can be more helpful for you. The last one is good psychiatric management. I missed one, so excuse me. The next one will be transference focused psychotherapy, also called psychodynamic psychotherapy. TFP aims to help you to understand your emotions and interpersonal difficulties through the developing relationships between you and your therapist. You then apply these insights to ongoing situations. Now, the last one is good psychiatric management. This treatment approach relies on case management, anchoring treatment in an expectation of work or school participation. It focuses on making sense of emotionally difficult moments by considering the interpersonal content for feelings. It may integrate medications, groups, family education, and individual therapy. Now, we did just mention medications, so we're going to cover what exactly medications are used and why they're used. What their uses are for. Although no drugs have been approved by the FDA, especially for the treatment of borderline personality disorder, certain medications may help with symptoms or co-occurring problems such as depression, impulsiveness, aggression, or anxiety. Medications may include antidepressants, antipsychotics, or keyword mood stabilizing drugs. So you're going to need to talk to your doctor about the benefits and side effects of any and all medications. When should you seek hospitalization for borderline personality disorder? Well, at times you may need more intense treatment in a psychiatric hospital or clinic. Hospitalization may also keep you safe from self-injury or address suicidal thoughts or behaviors. So depending on how severe it is, depends on when they will put you in a hospital. The recovery for it, well, remember, recovery takes time. Learning to manage your emotions, thoughts, and behaviors takes time. Most people improve considerably, but you may always struggle with some symptoms of borderline personality disorder. You may experience times when your symptoms are better or worse, but treatment can improve your ability to function and help you feel better about yourself. You have the best chance for success when you consult a mental health provider who has experience in treating borderline personality disorder, and that is so important. Mental health is just like physical health. If you have a physical problem, like with me, I have what they call retinitis pigmentosa. If I go to just a regular eye doctor, they're not going to know what's going on with my eyes. When I need to get checked because I'm noticing different things, I need to go to an eye specialist because they are more educated and more trained in special eye diseases like retinitis pigmentosa. So the same thing goes for your mental health. You want to make sure that you go to a mental health care provider that knows about borderline personality disorder, because if they don't, they could give you the wrong medication or a wrong diagnosis, and it could do more harm than good. So always make sure that you have that right. Okay, as far as coping and support, like I said earlier, they have the STEP program. That's a good example for support. They do have the suicide hotline, which I mentioned in the first video, and they have another one. So those are some good avenues. But always make sure you learn about the disorder so that you can understand the causes and treatments of it. That's why these are so helpful. For anybody that think they may have it, know somebody that may have it, education is the first step to making things better. Always be educated about it. Learn to recognize what may trigger angry outbursts, and always seek professional help. And there's a whole list of them, but I'm not going to go through the whole list, because it was basically on the treatment and diagnosis. But make sure that if you think you have borderline personality disorder, that you talk to a mental health caregiver and make sure they deal with this, because not all of them do. A lot of them are generalized. You want to speak to somebody that deals specifically with this so you don't get misdiagnosed. And if you feel, like things have gotten real bad, that's when you use the toll-free numbers and you get people involved. And if you know somebody with borderline personality disorder, please, 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 I implore you, do not judge a person by what you see. That's why you need to see with your heart and not with the eyes. Because when you see with your heart, you want to learn about it. You try to be educated about it, more understanding, more loving and caring. Because as I said, they go to where they feel really bad about themselves as it is, and they can have angry outbursts. And there's other times when they will feel like they don't matter, that they're not important, where they're suicidal. Now, a lot of people don't understand when somebody is really serious about suicidal, they're not going to leave a note. You may find a note, but you're not going to know about it. Most people that commit suicide don't talk about it. They show signs of depression and anxiety, and they withdraw a lot. But when that time comes, they just go and do it. because they don't think anybody cares to let them know, and they don't think that their life matters to anybody, and they just want to end their life. That's why it is so important for us as human beings, friends, family, acquaintances. It doesn't matter, even if it's a stranger. It does not matter. Just all that matters is that you think before you speak. Because what you may think is funny and just a small joke and not harmful could be the straw that breaks the camel's back and makes them take their life. Or you could be on the other hand, which is the one I'd rather be on, where you could say something uplifting to them, encouraging and inspiring. Let them know that their life matters. Let them know that they are important, because they are. Every one of us here on this planet was put here for a reason. So we're all important. Every life matters. Everybody. Okay? So remember that. Your words can be like a two-edged sword. They could help heal and inspire and encourage, or they could kill somebody. Think about it. Take that sword out of your mouth. Make it to where it's always positive. It's not only good for them, it's good for you. Because when you start thinking and saying positive stuff, you're releasing chemicals inside your body that heals you physically, spiritually, and emotionally. And we all need that. Do you ever wonder why some people are always sick? It's because they have a lot of negativity in their life. And it's scientifically proven. Most people that are always sick is because there's so much negativity in their life, where they become negative. People that are positive all the time hardly ever get sick. I mean, yeah, we'll get little colds, but we don't get sick like everybody else, where we're got a flu for 3 or 4 weeks or whatever. I mean, we're not immune to sickness. But when we're being positive and we let that positivity out, we're releasing chemicals inside our own bodies that will heal any type of sickness. It's a natural mechanism that has been instilled in each and every human being. So you want to live a healthy life? My advice to you is try to start living positive, being encouraging and uplifting to people. Don't judge by what you see. Look deep within with your heart. Learn to see with your heart. Even if that means you walking around your house with the blindfold and you're just talking to different people. You listen to all the sounds. You can do that even without being blindfolded. As a matter of fact, in my video for tomorrow, that's going to be uploaded, you will see it's called the Penny Walk. And that teaches you how to use all your senses. And that's when you see with your heart, everything is amplified for you. All your senses are amplified. And you start to enjoy things. That's the first step, is enjoying what's around you. Take the time. And that includes people. It is so easy to make a list of everything wrong with somebody. But I challenge you out there to, instead of finding a list of all the bad things about a person, make a list of all the good things. I challenge you. Right now, I challenge each and every one of you to do that one simple exercise. Just 5 things. Just 5. That's it. Find 5 nice things about somebody. Sit down and say, okay, what is the 5 nice things about this person? And write them down. Take a note of the time. In the beginning, I'm going to tell you, because society has taught us to be more negative than positive, it's probably going to take longer to find 5 good things than it would be to find 5 bad things. But here's the thing. If you do this on a daily basis, all right, just pick one person each day and you do this on a daily basis of starting to find the 5 good things about them, just 5. You don't have to do a big list, just start off with 5. You will notice that each and every time you do it, it will be easier and easier. So what we used to be able to do real quick with somebody with their negativity stuff, you'll be able to do with positive. And you'll start changing and you'll feel better about yourself. And you can see the difference. That's why I challenge each and every one of you out there to do that. And then let me know at the end of later on. You can text me through Messenger, you can get a hold of me on Twitter, or you can come back to this video and put in the comment section what happened during that. Do that for a week, just a week. I'm not asking for anything longer. Try that for 1 week. That's my challenge to you. So until we see each other again, remember to see with your heart and not your eyes. Because what the eyes see isn't important. What truly counts is invisible to the eye, because only the heart can see what matters. So until I see you again, I love you all. Bye.